Now, this patient was misdiagnosed by their GP. They've actually been treated with a course of antibiotics because the GP thought that this was actually the ear infection going here, which was causing a lot of pain inside the ear canal. But this actually wasn't an ear infection. There was something else going on there, something very different actually that was causing the pain inside that ear canal. So stay tuned for this one, guys. But what we've got here, you can see in this patient, we've got a very, very deep plug inside this patient's ear canal. Let me just get rid of this mouse, sorry. And what's going to happen here is we're going to need to remove this. Now, the patient's been complaining of pain. They've done, I think it was a 10-day course of antibiotics altogether to try and get rid of it, but the pain hasn't subsided. So they came along to see us today. And what you can see in here is you've got this very, very sort of almost like a little bit of skin here right at the front end of this plug, but a very deep plug nonetheless. But what you could also got is a very, very narrow canal. Look at the size of the entrance to that canal. Now that's actually a fine end, which is tiny, tiny little tubes, only about, I think it's 1.8 mil, I think, something like that in diameter. And they can't even get that in the ear canal. So this was actually Taylor's patient. So what Taylor's having to do here is hold the ear canal open to be able to get this tube inside. Now, we've got a lot of dead skin collecting down here in the ear canal. No obvious sign yet as to why we're getting as much pain. Sometimes when the wax is very, very deep like this one is, you'll get a bit of pain associated with it. But it doesn't really, there's no redness, no irritation, which is something you'd expect to see with an infection. Even sometimes post-infection, you'll get a lot of infection debris that's in there, and it certainly doesn't look like that. But what Taylor's getting a hold of now is something a little bit harder. You can see him moving from side to side, just trying to clear some of these bits out. Always a very, very difficult removal when you have a tiny entrance to the canal. And what's happened here is the actual canal entrance just folded over, which makes it a lot harder to get in. But let's take a look beyond. So we've got, you can see he's struggling here just to get the suction tube and the visual at the same time with this tiny little canal. But he is doing a good job. He's trying to clear some of this excess debris off the left-hand side, and he's trying to look to see what is causing this issue deeper in. There we go. Now he's got a grip there, and you can see that whole plug's here all starting to come forwards a little bit now. There we go. So let's see if we can lift this up and pull this down. There we go. So we've got this quite hard piece of, it looks a bit like wax, but it's not wax. What we can see in here, you can actually see a couple of little fibers at the bottom here. If you're a regular viewer of the channel, you've probably twigged what this is already. But you can see he's going to pull this now. I know what we're going to have now is when he pulls this forwards, the canal is going to collapse down around it. So he's switched up now to using the crocodile forceps here. Just about getting the forceps in and be able to open the jaw to get onto this plug. But he's got a hold of that little fibrous part. And what we can see here is this is actually, oh, it's nearly there. I won't spoil it till it gets to the end. A little bit more of a wiggle. There you go. This is actually the end of a cotton bud. So that's what was causing the pain in this particular patient's ear canal. And you can see it was deep. Now you can see a little bit of redness down really close to the eardrum. There's a little bit of redness on that left-hand side of the eardrum there. And that's basically where this cotton bud's been sitting in here and right on top of the bony portion of the ear canal and really irritating the skin underneath, which is where the pain has come from. So this particular patient was using antibiotics. They've been using olive oil, all sorts of other bits. And what's been happening is that cotton wool ball on the end of the Q-tip, on the end of a cotton bud here in the UK, has been absorbing all of that and sitting and kind of, so it's not really been helping at all. And that's why you've got this very dry layer of skin here as well on the in the deeper portion of the ear canal, is where that cotton bud just been sucking all the oil that we produce on the canal, sucking all up and any moisture in there into the cotton wool, and then it's just been causing this to dry the skin underneath. So Taylor now has got a very, very delicate job on his hands here. You can see he's really pulling away, and in fairness to Taylor Green, he is the king of curettage, Taylor Green. He is very, very good at curettage. He's also very good in these very narrow canals as well. He's got super precise technique. He's very good at that. And what you can see here, this is the other ear canal, and you can see a very, very deep piece of wax. Now, wax isn't formed this deep in the canal. So if you needed more proof that cottonwood buds were being used, you can see on this side that this wax has been pushed right down on top of the eardrum on this side. So a real kind of doozy to get out this one, a real tough old one to remove. So let's get this, give it a little bit of a pull. There you go. You can see it, especially this right hand side here, that's always difficult to get to. In anybody's ear canal, it's always, I think, one of the toughest places to remove wax from, especially if it's right in the recess. You can see he's trying to gently tease this out of the gap, but what a job, fair play. Just clip the edge of it there and managed to pull that whole thing out of the recess. Let's have a little look beyond that then. I think we've still got the piece on the left hand side. A couple of little squishy bits, so he's going to just go in and tidy this up as well. Guys, don't forget, if you are enjoying these videos, you can always like, heart, share, follow and subscribe for me. That way then you get to see even more videos. If you really enjoy the videos, you can also consider becoming members of the channel, and that way then you get to see even more videos every week. You get 2 more videos every single week. So we're just going to pull this little bit of dry skin. Not easy when it goes down into the recess because there's not a lot to hold on to, but he's doing a really good technique here of pulling down, which is peeling. There you go, from the inside of the recess. We're just going to grab this bit as well. There we go. Not actually a lot of my videos coming up over this week as well, guys. Mrs. B's actually off post-surgery, so she's off for another 4 weeks, which means obviously I've got to do a little bit more of the day-to-day running of the business as well, and the clinics, so I'm not seeing as many patients. So you will see me popping up sporadically throughout these ones, and as it's worked out today, Taylor's seeing patients, and I've had to come in and do this just while he's not here, unfortunately. So we will be back to normal soon, where both of us are back on the screen, but for this week, you're just going to get me, certainly for the first couple of days anyway. So this is what was removed. You can see that little cotton bud right in the middle between the 1 and 2 centimeter mark, which is between the 1/4 of an inch and 3/4 of an inch, I think it was. So yeah, not an easy one. This is actually Katie's video here as well. So Katie's got this kind of very sort of impacted wax plugs is what she's described as, but what we've got is a very mushy, oh goodness me, very mushy plug right at the entrance, wrapped in some skin, just for good measure. So she's just starting to lift this. Now Katie's come along massively. She's doing such a good job at the minute, Katie. If you're new to the channel, you probably won't have seen Katie. She was, if you go back through her catalogue, she is on there for a little bit. She's taking a bit of a break from the social media side of things at the minute. We're hoping she's going to come back soon, fingers crossed, in front of the screens. I know you guys have missed her as well. But Katie is our hearing care assistant, and she's been fully trained in wax removal, and she's actually doing brilliantly. I can't get over how well she is doing. Obviously, when we get new starters that do wax removals here at Audiology Associates, they go through a really kind of intensive training course with me and Taylor. So they have their official training, and we're also shadowing them for ages and ages and ages, and we're on hand as well to go through. So they are learning, just the technique as me and Taylor do it, so it's a really handy little thing to do. So she's used a little bit of irrigation there, which is just going to get rid of some of the softer, squishier bits of debris, and now we've got these long kind of strips of dead skin. So we've got the forceps going in here now. Not an easy one to grab hold of because the skin is folded off the side, so it's a little bit harder to get the angle you need on the jaw of the forceps. It's just peeling away there. Sometimes what I'll do is if I've got a piece like this, I might just use something like a Rycuret or a Jobson horn just to go down the edge and just kind of clip it off, just to get rid of it. So it doesn't always respond particularly well with suction. And how long? Oh my goodness, we got a long peel maybe on this side. Yeah, you can. Whoops, it is. There we go. Just hit that little bit of skin at the top. So the canal now itself is clear. And what irrigation is really good at doing, irrigation is fab at taking the wax away, but it's not always brilliant at removing skin. Okay, and you'll find that obviously there's a reason for that. We don't want to jump in the shower and dissolve. So our skin's a really good barrier to water. So what we've got then is when you use irrigation, the water passes over the top of the skin, will flush all the debris out, but it'll keep the skin intact. And that's what's happened here. So just a little bit of dry skin. Happens a lot more as we age. We don't produce quite as much oil as we used to when we first, when we were quite young, and there was a lot of oil keeping everything nice and soft and moisturized. So it does happen, unfortunately. But there we go, lovely and clear as well. Guys, if you loved the cotton bud one, I've got a brilliant video, which I'm gonna post, can never remember which way around it is on YouTube, one of these corners, which actually shows me removing 12 cotton buds from somebody's ears. It is a cracker, it is from the same patient. It flabbergasted me when I did it, and I guarantee it's a good one for you to watch, so make sure you check that one out. But until next time, guys, as always, take care of yourselves, take care of your ears, and take care of one another, and I'll see you again soon. Bye, everybody.